Assalamu alaikum, welcome to Medical Corner. Today our topic of discussion is how to diagnose the shoulder pathologies. First of all, you should have to know about the shoulder pathologies. There are three types of the shoulder pathologies. The first one is the hypomobility syndrome, which is very common among our population, which is commonly caused by adhesive capsulitis and glenohumeral osteoarthritis. Adhesive capsulitis is also known as the frozen shoulder. And the second one is the painful shoulder syndrome, which is commonly caused by the subacromial impingement. What is basically the subacromial impingement? There is a space beneath the acromion process in which bursas are present and tendons of the rotator cuff muscles is passing through this space. If the bursitis occurs or the tendinitis of any of the muscle of rotator cuff muscle can cause the painful shoulder syndrome. And the third one is the hypermobility syndrome, which is caused by dislocation of the shoulder joint, subluxation of the shoulder joint, and the apprehension at the shoulder joint. And what is the apprehension? There is a limited range of motion. The patient will unable to complete the range of motion at the shoulder joint just due to the fear of dislocation of the shoulder. Okay, come to the main point. How to diagnose the adhesive capsulitis and the glenohumeral osteoarthritis. If there is the limited internal rotation, limited abduction at the shoulder joint, and the limited external rotation, the patient capsular pattern will be positive and patient will be the candidate of the adhesive capsulitis. If the capsular pattern is negative, then on X-ray examination, there will the subchondral sclerosis, joint space narrowing, and osteophyte formation. This type of the patient will be the candidate of the glenohumeral osteoarthritis. Okay, then come to the painful shoulder syndrome, which is commonly caused by tendinitis of the rotator cuff muscles, and the muscles include supraspinatus, infraspinatus, teres minor, and the subscapularis. These all the muscles are the part of the rotator cuff muscles, and the tendons of these muscles are passing through the subacromial space, so the tendinitis of any of this muscle can cause the painful shoulder. And the fifth muscle, that is the long head of the bicep tendon is also passing through this space. So tendinitis of these muscles can cause the painful shoulder syndrome. Bursitis can cause the painful shoulder syndrome, and the soft tissue injury or the biomechanical cause can cause the painful shoulder syndrome. Diagnosis of the painful shoulder. Painful arc is the main diagnostic test for the painful shoulder syndrome. If this test is positive, the patient will be candidate of the painful shoulder syndrome. But to confirm this test, we'll do the draw palm test and the Neer's impingement test. If both of these tests is also positive, the patient will definitely be the candidate of the painful shoulder syndrome. To rule out which muscle is involved, we'll do individual test for the individual muscle. To test the supraspinatus muscle, we'll perform empty can test or the Hawkins-Kennedy test. To rule out infraspinatus muscle, we'll do infraspinatus stress test. And to check the third one muscle, that is the subscapularis, we'll do the lift-off test. To check the teres minor muscle, we'll do the Horn-Blur test. And to check the long head of the bicep muscle, we'll do Spears test or the Yergason's test. So in the next video, I will teach you how to check the hypermobility of the shoulder joint and also how to perform all these diagnostic tests. Thank you for watching. Like my video and subscribe my channel.